We talk a lot about metabolic syndrome. In 70-80% of our episodes, we're referencing it. When I looked back through our content that we've created, it's been quite some time that we had an episode committed to just metabolic syndrome. So I thought this would be a great time to layer in another specific discussion. And this is about, can metabolic syndrome be reversed? I think this is really important because we reference it. It's everywhere. It's all around us. 60-70% of the U.S. population is dealing with metabolic syndrome. And they're wondering, can it be reversed? And we hope to address that question because it's a fair question and it's an important question to answer. But I think before we answer that question, I think it's super important that we do a quick historical recap on what is it, why is it dangerous, how's it diagnosed, and what do you need to be thinking about? Like, what is the mindset you need to have going into this if you have metabolic syndrome? So quickly, in medicine, I always say we like to name things. It's one of our favorite things to do, is to put names at things. Unfortunately, when we can't come up with a really clever name and we see a certain illness or a cluster of symptoms, we just call it a syndrome. So like fill in the blank syndrome. So metabolic syndrome is a disease process that we have identified as medicine as a cluster of conditions, when found in conjunction with each other, represent this syndrome that is due to a metabolic thing. And this metabolic thing is really the root of all metabolic disease, and we'll kind of get into that. But why is it so dangerous? And I think, simply said, metabolic disease is the single greatest variable that you can manage to have the great impact of your overall health and vitality and longevity. This is fueling the flames of diabetes, heart disease, cancer. Basically, it's the gateway disease to all of the diseases you don't want.
Root cause.
It really does. If you take all of the diseases that you're really most afraid of and you work backwards, it is the most significant outside of smoking. I'm just going to assume that people who are listening to this, who care about longevity, either don't smoke or have already stopped smoking. If you're smoking, ignore everything I'm saying and just stop smoking.
Right.
Assuming we're not talking about smoking. The next most important thing you can do, no matter what you're trying to achieve, is get your head all the way around metabolic syndrome. How do you prevent it? How do you reverse it? How do you delay it? All of these things. I just think it's number one. So, Jen, go into a little bit more detail. There are actually criteria that we use on the medical side of things to diagnose metabolic syndrome. We often have suspicion, but talk to us about what the criteria are and kind of how all that works in a diagnosis.
So, as you mentioned, we're looking really for these cluster sort of symptoms or identifiers for this subgroup of individuals that are at higher risk for the chronic conditions that you mentioned, which are, diabetes, obesity,
heart disease,
abnormal lipids. So they're all geared around that, but you have to have 3 or more of each of these criteria. So one is high blood pressure or hypertension. So systolic blood pressure 130, diastolic 85 or greater. So top number 130, bottom number 85 or greater. Elevated fasting.
Which, by the way, is much lower to diagnose hypertension than most people give it credit. Even in our own world, we have been quite convicted recently that we're not quite as aggressive as we need to be on blood pressure control. 130 over 85. 9 out of 10 people walking the planet, including physicians, leave that alone.
Yeah. Well, what I will say in our defense, it's very difficult, not really difficult. It's it needs to be a strategic diagnosis, right? So you cannot just take one static blood pressure.
It's got to be thoughtful.
Yes. Yes. And there's a a very
Blood pressure can go
intelligent
up
way to do it.
for any number of reasons.
Yeah. But how many times do we talk to some of our members and they get worried or concerned, which rightfully so, over one static blood pressure? And I have that conversation a lot where, hey, yes, your blood pressure is higher than normal, but let's take an average over time and really see what's going on versus like one blood pressure.
The point is it matters, and it matters a
Yeah.
lot, and the diagnostic criteria is way lower than anybody thinks.
Yes, that's right. Yep. The second one is elevated fasting blood sugar, or you'll see it on the lab sheet called glucose, and that has to be over 100. Low HDL, so less than 50 in women and less than 40 in men. So there's very strict criteria there, and that would be on your lipid panel.
Just a standard fasting lipid panel you should
when
get
you're
done.
getting that done. The same with triglycerides. So these are your blood fats, and those are typically over 150. So you'll see those elevated. And then truncal obesity, which is something that we screen our members for here as well. So waist circumference in inches greater than 35 inches in women and greater than 40 inches in men.
Yep.
So really, that's another area. You really need to be measuring it at your belly button or a little bit higher. So not down around your hips where maybe your belly is a little thinner.
No, you want to capture all the belly.
Yeah.
Actually,
it's that visceral
yeah.
adiposity that we're really checking for. That
Waistline is a really interesting metric. You know, it is actually like if there was one thing that you could check out of all of these things with high degree of probability, it's waistline.
Yeah.
You know, as the waistline increases, all-cause mortality goes up, which is there. I don't even think smoking has that claim to fame.
Yeah.
But now it increases lots of reasons that kill you, but like everything that kills a human, your risk of it goes up as your waistline goes up.
Yeah.
And it really is around visceral fat, truncal fat, so fat in and around your organs. This is a tremendously specific marker for metabolic disease and risk for chronic diseases that kill humans. So you need 3 of those 5 criteria at any one time, and you have diagnostic criteria met for metabolic syndrome. Great. So as we wrap up this section of the episode, like how should that make someone feel? I mean, so we have the diagnostic criteria, we understand what it is, we understand why it's important, but like, what do I do about that?
Well, I think, tying into your conversation in the beginning about things being a syndrome, we typically think about this on a spectrum because it's a precursor, as you've already mentioned, to a lot of the chronic and really awful chronic diseases down the line, like diabetes, heart disease, cancer, stroke, all of those things. But we typically see this as a slow burn, right? We don't see members coming into our practice very often with full-blown diabetes that just happened yesterday. That doesn't happen. It's happened over time, and our bodies are a very fine-tuned system where these systems and processes can get out of whack pretty easily, thankfully kind of slowly. But if we don't have an offense mindset, and we've talked about offense versus defense, this particularly is a syndrome where you have to continually be on offense to fight it, because we're living in, as we talked about on other podcasts, a very obesogenic, if I can use that word,
I think so.
Environment, right? We can get meals DoorDash to us. We have fast food at our disposal. Very few people, I'm just speaking generally, eat at home anymore, or whole food diet, exercise appropriately. So those type of things, which we'll talk about later, of how to combat this, you constantly have to be on offense to fight this. Yep. Otherwise, if you're not, things could turn for the worse, and you go down a path that you really don't want to be down.
Yeah, I agree with you. I would even take it even further and say that if you don't have an active offensive mindset to be hunting for this and or reversing, just super proactive offensive if the default, if your strategy or is just see how it goes, or keep giving your best effort and we'll just see what happens, and more of a defensive, sit back, reactionary, the default physiology in 2023 and beyond in all developed nations is metabolic disease.
Yeah.
You will become a metabolic syndrome statistic, and you are dramatically increasing your individual risk for chronic diseases that kill humans. It is our belief and the way we practice, and it's our conviction, it's why we create this content to give it to the world. If you don't commit to having an offensive mindset to go hunting for these things and understand why they matter, metabolic disease is inevitable for most everyone.
Yeah. And I love the word you just used, strategy.
Yeah.
That is huge. Ties really nicely in with offensive mindset. That is a strategy.
Yeah. Okay. You got to call the right place.
Deploy it.